Hello, I'm Eleri Butler, Chief Executive Officer at Family Safety Victoria. For Victoria's communities, our frontline specialist family violence and sexual assault services, our Aboriginal services and our family services have never been more important to us than they are now. We're working collaboratively to ensure services continue and our responses take into consideration the elevated risks associated with the coronavirus pandemic, which is occurring at the same time as the global pandemic of violence against women and girls. Family Safety Victoria has been working with our sector partners to ensure the continued delivery of safe, high-quality support services to meet the often multiple and complex needs of people in our communities. The Victoria Government has invested $40.2 million in funding to ensure those at risk or who are experiencing family violence and sexual assault have access to the support they need at this time, which may include having access to a place of safety in a crisis. Family Safety Victoria has developed a series of MARAM practice notes to support targeted responses to family violence during the pandemic. These practice notes focus on improving safety outcomes for victim survivors and managing and reducing the risk posed by perpetrators of abuse. This includes assessment of risks associated with coercive controlling behaviour, any change or escalation in violence, and the increased risk of suicide or self-harm. Children and young people face additional and specific risks during the pandemic, whilst their usual social and support networks are restricted or operating differently. Family Safety Victoria is working with specialist family violence and sexual abuse services, with children's services, with child protection, Child First Family Services and the Orange Door to ensure children and young people are safe and supported. Services at the Orange Door have moved quickly to deliver support online and by telephone, which includes assessing people's needs, safety planning, providing crisis responses and access to ongoing support through specialist services. Where required, arrangements can be made to see people safely in person where physical and social distancing requirements can be maintained. I want to acknowledge all our specialist and Aboriginal service providers and the Orange Door network across the state and all their staff who've worked quickly and tirelessly to transform their services and continue to meet the needs of Victoria's communities. By working together, our combined efforts have ensured specialist and family violence services have continued to be available to communities throughout the pandemic.